that's the trend, right? Patients want to get care where they want to get it and when they want to get it. So we are, doing subacute rehab at home, acute care in the home with hospital at home programs that we're developing.
What does your Department of Innovation focus on these days?
Yeah, so we deliver care virtually. So we have an on-demand virtual urgent care. That's for anybody that's in New York or New Jersey that wants to pick up the phone and get a hold of a doctor real time. Okay. We're also doing a lot of other kind of unique models of care, community paramedicine, where we take some of the sickest, highest risk patients and we take care to them, bring all the technology to their home, and then oversee care with the paramedics in the house with our telemedicine doctors. And we're also kind of further going down this path of care delivery in the home, which is, that's the trend, right? Patients want to get care where they want to get it and when they want to get it. So we are, doing subacute rehab at home, acute care in the home with hospital at home programs that we're developing. So really kind of novel, innovative approaches.
Okay. So obviously COVID happened. We saw this massive spike in interest and need and desire for telemedicine. And that's cooled off some in terms of players like Teladoc or MD Live. We haven't seen them explode, and yet now Weill Cornell, now you are innovating within this market and sort of bringing a new reality of digital health to fruition. Is that fair to say?
Yeah, I'm finding actually, while some of these other classic telehealth players are having a hard time, our telehealth programs are actually growing. Okay. And maybe it's just because we're a little different. We're an academic medical center. The word has gotten out amongst our patients. We have a fairly captive audience, and we've created ways to, simplify access.
You're already as a patient, you're already dialing into the portal to sign up for an appointment, and so why not do the virtual one?
Yeah, and also what we've done is we've found ways to kind of plug patients in. They call our nursing line. They're calling after hours. After the emergency department, every patient in our entire health system gets a document with a link to, log into, this is how you get in to see a virtual care doctor. We've created pathways for follow-up after an emergency medicine visit. So, you have a wound, you came for a wound. Classically, we used to say, come back in 2 days to the ED. Yeah. Now we just, make a real-time appointment with you before you leave the emergency department, and they come and see us, on video, and they don't have to leave the home. They can keep taking care of their kids, their mom, their dad. They can stay at work.
The word that comes to me is trust. When I think about early attempts at telemedicine, you were thinking a random doctor shows up on your screen, right? If I'm used to coming to Weill Cornell, it's like, hey, well, now I can have Weill Cornell in my home. There's trust there.
Yeah. I also think that what separates, some of the academic perspective on telehealth is that we really hone in on the training component for our doctors, right? So the patient-provider relationship is fairly sacred, right? Every doctor spends years in medical school learning about bedside manner. We've coined this term webside manner, I think,
Cute.
So,
I like it.
You get none of that. And the dynamics of a relationship are really different.
Yes.
So, think about like a traditional hospital or clinic encounter. You drive to the clinic, you get there, it's branded, Weill Cornell, whatever it is. It could be any center, clinic. You get there, you wait in the waiting room, which is also branded. You get into the room, the patient room, they put a flimsy gown on you, and now the dynamic is that you're the patient, but the doctor kind of controls that environment. Yeah. On telehealth, it's really on us to create that comfort level without all of that other kind of messaging, subliminal messaging being available.
Okay, so what are some of the practical ways you do that?
Yeah, so it's really simple. Just professionalism, right? Like wear your white coat, look fine. How do you do proper eye contact? How do you frame yourself in the camera?
Have you found that folks have struggled with that, or has it come naturally? Does it have to be taught, in other words?
You have to teach it. Yeah, you have to teach it. And then more globally, you think about, caring for a patient remotely isn't the same as caring for a patient, in person, right? I think you can do almost everything, right? I can do a neurologic exam, and I can, do an abdominal exam, and I can do a cardiac, I can get the vital signs even without wearables and peripherals and all these other things. You just have to be taught to do that. Yeah. And if you can do it, it becomes a very, very powerful tool. So we really hone in. We've built a whole graduate medical education program where we're training and teaching every resident that comes to New York Presbyterian. We're also, talking to other folks and other institutions about how do we kind of help train physicians so that way care delivered virtually actually is similar and maybe even better quality. Yeah. That's really what it comes down to.
I feel like you're kind of at the tip of the spear here, but I wouldn't necessarily know. Is every major urban teaching hospital like Weill Cornell doing something like this, or maybe not?
Yeah, I think now, in the last few years, you're seeing more and more medical schools buy into this concept. There are certainly other academic centers that are doing education. We have a center, it's called Center for Virtual Care. We do a lot of things in that center. One of them is this kind of education component, and it's fairly robust. And so we're proud of it. We've published on this. We are, doing very kind of good work, and we're also honing in on specific use cases also. So, how do you train a neurologist specifically? How do you, for them and for their types of patients? What does an orthopedist need? So that's kind of our next phase of development, and that's where we're going with our education offerings.
Okay, so we're at Health, talking a lot about innovation. Let's talk about how you work with startups, because the technology for like a glorified Zoom call doctor's visit, that's existed for a while. You're talking about some of the basics of like good website manner, that's existed for a while, but there's also new tools, yep. There's new things we need to deploy. Yep. How do you think about what kinds of startups to partner with?
Yeah, so again, we have a Center for Virtual Care. What we're doing is we're trying to kind of limit and simplify those friction points between academia and industry, right? Okay. So everybody here, right, wants to find a partner to unlock, a clinical trial or, some more data for that next seed round, or maybe they need some more data to unlock some sort of sales. So what we're doing is we're trying to find ways to partner with companies. Right now it's in the emergency medicine space because that's what we specialize in, but we are growing with the idea to expand beyond just emergency medicine. So yeah, we're finding ways to bring in through a vetting process, industry partners, and we are, helping them with, aggregating data or, access to the patients to enroll them in a pilot or a trial. Yeah. And it's been, a very interesting concept, and I think it's certainly happening some other places, but we're taking this from a little bit of a different angle.
Yeah, every startup that we work with at Startup Health would want to be in your institution, your patient population, your data, that would be the dream. So the question is, what are you actually looking for? The type of founder, the stage of company.
Yeah, we're really open to any stage of founder. Typically, we're finding that we're looking for folks fairly early in their founder journey. Okay. Maybe pre-seed, seed, maybe Series A. They're just, what we're looking for is solutions that make sense for patients. Yeah. What we don't want to do is plug in toys just for the sake of plugging them in. What we want to do is find meaningful solutions for our patients and also for our providers.
Yeah. I heard a great term by somebody this morning who said that they look for the perfect imperfect. They don't want a company that has everything all laid out, because they want to be able to plug in their expertise. Yep. You've got the right founder, you've got the right product, but maybe you don't have the right data. Yep. We got the data.
Exactly, yeah, and every interaction, every partnership will look a little bit different. Yep. Sometimes they just need access to our PACS imaging to be able to, train their model or whatever it is, right? And some other folks may want to actually talk to patients. Some other companies, we're looking for flexibility. We're looking for a founder that's willing to think outside the box, that's got, a clear mission to improve care. And again, just a willingness to kind of, work in academia with an academic center.
Tell us a little bit about the New York City ecosystem for health tech, kind of what's being incubated.
That's great. Yeah, so we New York is a growing health tech hub. Yeah. I heard, I think recently, that there was more venture capitalist investment last quarter in New York than into companies in the Bay Area. I'm not sure if we're going to have to double check that. Yeah. But I think I think it's true. Okay. And we have Cornell Tech. We have a very good partnership with them. Some of this work that I just spent time describing to you about our kind of partnership with industry comes from lessons learned with partnering with Cornell Tech. And they have a great program where they are, helping founders develop a company from an idea to minimal viable product and beyond. And so we've partnered with a few folks from there.
Okay.
And they are just part of the ecosystem in New York. There's certainly other folks outside of our own institution that are doing really, really meaningful work in that space.
So last question, what's one piece of advice you would give to a founder who's trying to build a company in the earliest stages so that they'd be ready for a collaboration with a group like yours?
Yeah, just make sure you have a clinician on your team. I think no matter who it is, I mean, if it's a nurse, a physical therapist, find that person that can give you some guidance, so that way at the earliest point of innovation, you can have clinical input.
Okay.
That's really, I think, the key.
Okay.
You can have the greatest idea in the world, but if nobody uses your shiny toy, it's not going to work, right? So ask the experts, wherever that expert is, and oftentimes that's the clinician.
All right.
And it doesn't have to be a doctor. It can be anybody that's at the bedside of the patient.
Awesome. Thanks for the update, Alex.
Good to see you.
You too.